My name is McArdle, and I'm the Initiative Manager for Relief and Resilience. And specifically, we are talking about disaster relief and resilience. We're at the beginning of this exploration. It is the degree of interest and challenge accelerates dramatically with every conversation that I have. I was at a conference in Orlando a couple of weeks ago. It was the National VOAD Conference, which is Voluntary Organizations Active in Disaster. And this was their 18th annual conference. The acceleration of work that's going on in how to respond to disasters effectively, both local disasters and disasters that occur anywhere in the world, is huge, particularly following Katrina. I think that when we're looking at the terrain here, we're seeing that we had a disaster of unparalleled proportions in 9/11. And then we had Katrina, which was really blew everybody away in terms of the complexity and the long tail on this issue of disaster recovery. And so I think it's almost like a new science that people are looking at. You know, what do we need to do? How can we do it better? One of the groups that presented at the Orlando conference was our own Sarasota County Organizations Active in Disaster, and we are a little bit different in that we have county government involved in this process. Bill Little, who's the head of our Health and Human Services group in the county, has been very active in promoting this collaborative effort that SCOED has been engaged in since about 2005 under the direction of Ed McCrane, who is just amazing as our emergency management expert. They made a presentation about the work that they have done across Sarasota County, and it really did excite everybody at this conference. They were one of the stars there. So I think we're very lucky that we have such a high expertise group locally to look at, to draw on, and to talk with. A parallel with their conversation was the Iowa VOAD. And interestingly, Iowa right now is kind of cherry-picking counties across the state that they want to get included in their own VOAD. Okay, they didn't even have two contiguous counties. So you can see that there's a whole lot of different approaches to what to do about disaster and disaster recovery. I had the great opportunity to meet with Dr. Ruvi Rogel, who is an expert based in Israel. He was one of the founders of the Israel Trauma Center, and he has been with the Community Stress Relief organization in Israel for years. And obviously they have a truly unique disaster environment that they have to plan for and respond to. However, one of the things that's interesting to me, from my conversation with Ruby, from listening to the presentations in Orlando, and from my meeting this morning with our own local Red Cross, there are themes that are emerging. Here are some of the themes. Number one, Ruby said to me, it is critical that everybody understand that the community is responsible for itself and that the individual is responsible for being prepared. Without any coaching from me, that's exactly what I heard from the Red Cross this morning. So individual and community preparedness is critical. Collaborations and relationships that are built in advance are critical. And while you know that conceptually, let me give you an example of how people are learning what that means. One of the groups that presented at VOAD said, in-kind donations after a disaster are really important from the corporate community. So they went to Cisco and they went to Walmart to look for donations of food. And what they found out was that they need to be very, very specific about what they ask for, because what comes can turn into a disaster itself, okay? So the whole idea of collaborating thoughtfully, not just we'll call you when we need help and thanks for telling us in advance you'll help, but being really thoughtful, being specific about what you need so that you get what you need. It's like just-in-time manufacturing. You get what you need, when you need it, at the right place, with the least cost, and the most capacity to deal with it. So collaborations and responsibility. In Haiti, there are about 80 different aid organizations on the ground that have been working together everywhere. In the China earthquakes, in the tsunamis in Asia, anywhere. They know how to work with each other. They know how to work on the ground locally. Here's an example, the Shelter Box organization that is not part of Rotary but has connections with Rotary. They already had connections with 13 Rotaries in Haiti. So they knew what to do. They knew what they needed in those boxes, and they knew where to deliver it, and they had a system to distribute. Volunteers, one of the things that I learned in Orlando and got reiterated again this morning, again a theme. Volunteers are great. Volunteers can be a disaster in themselves. The concept of the unaffiliated volunteer, if you've been following any of the blogs with regard to the Gulf oil spill, you'll see things like, I have a truck and I'm unemployed and I'm on my way. Well, good heart, but what are you going to do with your truck when you get there? Where are you going to sleep? What are you going to eat? What are you going to do? Who are you going to report to? Where are you going to get gas for your truck? All of these things. So the concept of volunteers, as Ruvi from Israel said to me, really needs to be taken to a new level so that volunteers are, in a sense, unpaid employees. They have a specific job, they have specific skills, they report to somebody, they're accountable, they're managed, they're trained, they're supported. So relationships, volunteers, being specific, collaborations in advance that are really thoughtfully done. Education, and there are a lot of themes around this table today that really come together for me. You're talking of, every one of you has talked about education, and that's really critical. One of the things that we discussed this morning at Red Cross, which is why I couldn't be at your webinar, I'm sorry, was that people don't know what the Red Cross does, and they don't know all of the programs that exist in the Red Cross. The most frequent disaster that they respond to is a house fire. And they have great collaborations with certain parts of the community that alert them to those needs. I mean, the Red Cross across the country, I found this out this morning, trains 45,000 people a day, every day, in first aid and CPR. And Kevin Lindbergh gave me the quote of the day. It costs almost as much to be ready to respond as it does to respond. Well, there was an opportunity to educate the donor community as to what really helps that organization do its job. So we're at the very beginning of this process, but what I'm starting to hear are there some themes about what people need to do their job the way they want to do it. And what I asked the Red Cross people today to think about was, we had a little bit of time for discussion about what if. What would you change? What would be better, X number of years from now? If you really could do this job the way you really want to, what would be in place? And so I asked them to start to think about that. And then as I was driving home, I thought, I need to talk to Janet about the blog. Because one of the important things for this initiative, like I think it's true for all of us, is to keep people connected in the conversation so that they don't say, well, that was a nice experience. I know I'm not going to get any money from Patterson directly, so I'll put that on the shelf. I need to keep them involved in the conversation. So I think, some of the technologies we're talking about and some of the social media, and Janet, what you've already started, is one way to keep, for me anyway, to keep those people engaged. We're just at the beginning. I can see these themes evolving over time, but I also think there's a tremendous amount of learning out there that we can put on the table and have everybody say, if we could do X, Y, Z, what would it be, and how would we do it? That's I think the fun from this, and I think that's pretty much everything.